Good morning, dear students. Today's topic is control of microorganisms using chemical agents. Control by chemical agents refers to the use of disinfectants, antiseptic, antibiotics, chemotherapeutic, antimicrobial chemicals in order to reduce, inhibit or kill microorganisms. So we are applying a large number of chemical agents such as disinfectants, antiseptic, antibiotics, chemotherapeutic agents, antimicrobial drugs, etc. either to reduce or inhibit or kill microbial growth. Various chemical agents that are commonly employed for controlling microorganisms include alcohol, phenol and phenolic compounds, halogen compounds, heavy metals and their compounds, aldehyde, gaseous agents, oxidizing agents, detergents, antibiotics and food preservatives. Effects of microbial control agents. The cell wall becomes fragile and get lysed by most antimicrobial drugs, detergents and alcohol. Plasma membrane loses integrity by the action of detergents and surfactants. Replication and transcription of genetic material in microorganism is prevented by some antimicrobial drugs, radiation, formaldehyde and ethylene oxide. Functioning of ribosome is interfered to prevent translation by chemical agents. Denaturation of proteins by alcohol, phenol, acid and heat occurs in microorganisms. So we can able to control microbial growth with so many control agents, either by inhibiting their cell wall synthesis so that the cell wall of microorganism become fragile and they get lysed with many of these chemical as well as physical agents. And plasma membrane also can be destroyed and they lose their integrity by the action of detergents and surfactants and using some antimicrobial drugs, radiation, formaldehyde, ethylene oxide, etc. The replication and the transcription of the genetic material, especially DNA, can be prevented in microorganism. And the normal functioning of the ribosome in protein synthesis get affected by chemical agents, which may result in the denaturation of proteins, and mostly alcohol, phenols, acids and action of heat produce denaturation of proteins in microorganisms. So by these mechanisms the microbial growth is controlled by various control agents. So first chemical agent is alcohol. Alcohol are antimicrobial agents. Germicidal action of alcohol increases with increase in molecular weight of alcohol. Ethanol is most commonly used alcohol for controlling microorganisms. Ethanol concentration between 50 to 90% are effective against vegetative cell. Alcohol causes death of organism by denaturing the cellular protein. Alcohol is a lipid solvent that damages the lipid bilayer of the cell membrane and cell wall. It is also a dehydrating agent and causes loss of water from the cell. Alcohol is commonly used as a sanitizer on skin, disinfectant to clinical instruments, thermometers and surgical instruments, and concentration above 60% is effective in killing viruses. So alcohol, it is a common antimicrobial agent and alcoholic germicidal action, it increases with increase in the molecular weight of the alcohol, and most commonly used disinfectant is ethanol, and it is used for controlling microorganism, and a concentration of 50 to 90% is effective for the vegetative cell, and it causes the microbicidal action by denaturing the cellular proteins in the microorganism, and it is a lipid solvent, so it damages the lipid bilayer in the plasma membrane of bacterial cell wall, and it is also a dehydrating agent, and it causes the loss of water from the cell, and it is used as a sanitizer for disinfecting the skin, and it is also used to disinfect the clinical instruments like thermometers, surgical instruments, etc. and a concentration above 60% is effective in killing viruses also. So alcohol is an effective antimicrobial agent which can be used to control both bacteria, spores as well as viruses, and it is used as a sterilizing agent, a disinfectant and a sanitizer, and 50 to 90% concentration is very effective against various microbial agents. And its mode of action is either it will denature the cellular proteins or it will affect the lipid bilayer in the plasma membrane of these microorganisms. Mode of action of alcohol. When alcohol is used as a disinfectant, it solubilizes the lipid bilayer of the cell wall and plasma membrane and create pores. The remaining alcohol enters into the cytoplasm through the pore and denature the cellular proteins, killing the bacteria. As concentration of alcohol increases, both denaturing and lipid solubilizing power and dehydration power increases, and they counter to each other. So absolute alcohol causes extreme dehydration resulting in shrinking of the cell. Hence further alcohol cannot enter the cell, therefore it can cause only bacteriostasis. But 70% alcohol is very effective in dehydration and denaturation, almost equilibrium manner, causing bactericidal effects. So this alcohol it solubilizes the lipid bilayer and create pores, and through these pores the alcohol can enter into the cytoplasm and denature the cellular proteins, and it also solubilizes the lipid part of the plasma membrane. But as the concentration of alcohol increases, the denaturation of the proteins as well as the lipid solubilizing power and dehydration power increases, and they began to counter to each other, so that in the case of 100% alcohol, that is absolute alcohol, extreme dehydration resulting in the shrinkage of the cell, so that no further movement of this alcohol into the cell takes place, and so the inside protein denaturation step will not take place. Only the shrinkage of the cell by dehydration takes place if we are going for higher concentration of alcohol. But if we are using only 70% alcohol, then dehydration as well as denaturation both will take place in an equilibrium, so that it can lead to bactericidal. That is, it means bactericidal means it can kill bacteria. So if we are going for 100% alcohol, that is absolute alcohol, then we can only keep the bacterial growth in a static condition. That means bacterial growth get arrested, but bacteria are not killed. When a favorable condition comes, the bacteria again become active and they will multiply. But in case of 70% alcohol, the bactericidal effect of this alcohol will be there, so that entire bacteria will get destroyed. Next is phenol and phenolic compounds. Phenol is a broad spectrum disinfectant. Vegetative cells are rapidly killed by concentrated aqueous solution of phenol, whereas bacterial spores are resistant to it. 2 to 5% aqueous solution of phenol is used as a disinfectant, and phenol has limited application because it is easily absorbed by skin as well as mucous membrane, and it is highly toxic. Phenolic compounds are used as disinfectants, and they are derivatives of the phenol. They include cresol and chloroxylenol. Cresol is methyl phenol, and it is used in Lysol, which is a disinfectant which is commonly used to sterilize glasswares, and it is used to clean floor. And this chloroxylenol, it is dimethyl phenol. It is an active ingredient of Dettol, which is a commonly used antiseptic. So phenol and phenolic compounds have wide application, and they are broad spectrum. That means they can kill or destroy a wide variety of microorganisms. Vegetative cells are immediately killed by this concentrated solution of phenol, but bacterial spores are somewhat resistant to this phenol. 2 to 5% aqueous solution of phenol can be used as a disinfectant. but it has limited application because of its toxicity, and the phenol derived compounds like cresol and chloroxylenol are used to sterilize glasswares, as well as this chloroxylenol, it is a content of Dettol, it is used as an antiseptic. Mode of action of phenol. Phenol and phenolic compounds kill the microorganism by disruption of cell, precipitation of cellular protein, inactivation of enzyme, and leakage of cellular materials. So phenol and phenolic compounds both are having bactericidal action. They kill the cell either by disruption of the cell wall or by precipitation of the cellular protein, or they inactivate the enzyme or cause the leakage of the cellular materials. Next is phenol coefficient test. An antiseptic or disinfectant is evaluated by phenol coefficient test. So various dilutions of the chemical agent are prepared and tested against equivalent dilutions of phenol with bacteria such as Staphylococcus aureus and Salmonella typhi. A phenol coefficient greater than 1 indicates that the chemical agent is more effective than phenol, and less than 1 indicate that it is less effective. So phenol coefficient test is usually conducted to test a chemical agent other than phenol to determine whether it is much more disinfectant than phenol or not. For that we are using various concentration of that chemical, various dilutions or various concentration of that particular chemical agent that is to be tested is prepared, and then it is tested against equivalent dilutions of phenol, and both these disinfectants are applied to bacteria like Staphylococcus aureus or Salmonella, and they are tested for different concentration. And if the phenol coefficient is greater than 1, it indicates that the chemical that is tested is more efficient than phenol, and if it is less than 1, then this indicate that it is less effective. So this is called phenol coefficient test. An alternative test is called in-use test. Here we are not using phenol. Here various dilutions of the chemical agent is prepared and it is tested against this test bacteria like Salmonella typhi or Staphylococcus aureus, and then it is evaluated for the efficiency. So that is phenol coefficient test and in-use test for the to test or to evaluate the efficiency of the particular disinfectant that is using. Next is halogen compounds. Halogen compounds mainly include iodine as well as chlorine as disinfectants. Iodine is used in many forms such as aqueous solution, tincture of iodine, and iodophore. Aqueous iodine and tincture of iodine. Tincture of iodine is an alcohol solution of iodine. Have some side effects such as staining and irritation. Combination of iodine and organic molecules are called iodophore, which has no side effects. Then uses of iodine. Iodine is effective against all kind of bacteria and spores. It is having fungicidal and to some extent virucidal function. And this iodophore, it is widely used for antiseptics of the skin, then mucous membrane and wound. Example of iodophore is betadine and isodine. Then iodine preparation can also be used for the purposes such as disinfection of water, air, and sanitation of food utensils. So iodine, it is a important halogen which occurs in two forms. It is either as aqueous solution or it occurs in three forms, that is aqueous solution, then tincture of iodine and iodophore. Aqueous iodine and tincture of iodine. Tincture iodine is alcoholic solution of iodine. They have some side effects such as irritation and stainings. So we are commonly using this iodophore. Iodophore, it is a combination of iodine and organic molecules, and it is having less side effects, so it is highly used in medical applications. And this iodine, it is very effective to kill all kind of bacteria and spores, and it is also having fungicidal and to some extent virucidal activity, and it is widely used as an antiseptic agent of skin, then mucous membrane and wound. Example, betadine. Betadine is commonly used to heal all kinds of wound, and iodine preparations can be used for purposes such as disinfection of water, disinfection of air, and sanitation of food utensils. So iodine is having wide application. Then mode of action of iodine. Iodine is a powerful oxidizing agent and irreversibly oxidizes cellular material. It denatures cellular protein. It combines with the tyrosine residue of protein and enzyme and inactivate it. So iodine, it is a oxidizing agent. It oxidizes cellular materials and thereby it causes the denaturation of cellular protein. It combines with the tyrosine residue. Tyrosine is an amino acid. It combines with the tyrosine residue of protein and enzymes and inactivate it. So thereby the protein, this iodine causes the denaturation of the cellular protein. So iodine mainly inhibit the cellular materials, especially cellular protein, by denaturing it, by oxidizing it, and combines with the tyrosine residue of the protein and inactivate it. Next is chlorine. Chlorine is one of the most commonly used disinfectant to maintain a low microbial count in drinking water. Calcium hypochlorite is used to disinfect in equipment in dairies, slaughterhouses and restaurants, and also used as a sanitizer for cooking utensils. Aqueous solution of sodium hypochlorite, that is 5.25%, is called household bleach. 1% bleach is also used as bathing water. Then higher concentration of sodium hypochlorite, that is 5 to 12% bleach, which is used as disinfectants in swimming pool and also for domestic purposes. And chloramines are used to sanitize glasswares and heating utensils. Chlorine, we all know that it is widely used in municipal drinking water supplies as a disinfectant, and it will helps to prevent microbial count, or it will lower down the microbial count in the drinking water. And this chlorine, it mainly exists as calcium hypochlorite and sodium hypochlorite. And this calcium hypochlorite, it is used as a disinfectant to clear the equipments in dairies, then slaughterhouses and restaurants, and it is also used for sanitizing utensils. And the sodium hypochlorite, it is a household bleach, and it is 1% of that solution is used for bathing water, used as a bathing water. And higher concentration, it is used as disinfectants in swimming pools. And chloramines, they are used to sanitize glasswares as well as eating utensils. Then mode of action of chlorine. When hypochlorite or chloramine is added to water, then free chlorine is released, which combines with water to form hypochlorous acid. Hypochlorous acid decomposes to release nascent oxygen. It is a powerful oxidizing agent and kills the microorganism by oxidizing the cellular components. Chlorine and chlorine compounds combines with microbial proteins and inactivate the proteins and enzyme by direct chlorination. Mode of action of chlorine is that when hypochlorite and chloramine, they are added to water, then the free chlorine is released, and that free chlorine, it combines with the water to form hypochlorous acid. And this hypochlorous acid, it is chlorine plus water. It decomposes to release oxygen, which is a powerful oxidizing agent, and that oxygen, it will kill the microorganism by oxidizing the cellular components. And chlorine components combines with the microbial proteins and inactivate the proteins and enzyme by direct chlorination. So chlorine, it will produce nascent oxygen in aqueous solution, which is a high oxidizing agent, which will oxidize the cellular components of microorganism and thereby kill the microorganism. And it also, the chlorine and chlorine compounds directly combines with the microbial proteins. They directly chlorinate the microbial proteins and enzymes and cause their denaturation. So this is the different way in which so the chlorine can affect the microorganisms. Chlorine gas is corrosive and toxic, so we are not using chlorine gas. We are either using derivatives of chlorine such as hypochlorite and chloramine as disinfectant. Then calcium hypochlorite and sodium hypochlorite are the commonly used hypochlorite forms of chlorine, and chloramines, they contain chlorine combined with the ammonia, and they are more stable and effective germicidal agent than hypochlorite. So chloramines are chlorine with ammonia, and these chloramines are much more stable and effective germicidal control agent when compared to that of hypochlorite. So chlorine, we can apply chlorine either in the form of hypochlorite or chloramine. Hypochlorite include both sodium hypochlorite and calcium hypochlorite, and this chloramine, they are chlorine with the ammonia, and they are much more effective and stable when compared to that of hypochlorite. So that is all for today's class. We can continue the other chemical agents for controlling microorganism in next class. Thank you.